Okay, we are recording. Now, Dr. Zach, would you like to introduce yourself?
Sure.
Thank
Well,
you.
good afternoon, everybody. My name is Zach Wiegraff. Hope you guys are doing well and staying safe indoors, please. I hope that's the case. But definitely want to just kind of, thank everybody for the opportunity to talk about what, the current events and what's going on and things. But I am an emergency medicine physician. I do work here in Central Florida at one of the local hospitals. And I can definitely say we're seeing a big change in what's going on with all the concerns for the COVID-19 virus that's out and about right now. So really want to kind of tailor this to the kids. So if the kids have any questions or anything, we can definitely, um, I could try to answer the questions the best that we can, but with the caveat of, this is all still very new to us. Where this is a process that we're still trying to get our hands around or wrap our hands around to get a hold of. So there's still a lot of unknowns and things. So I hope the kids are doing good, and I hope the parents are doing good too, because I got 3 little kids at home too, and they're fun right now. So being at home all day long. But just a couple of things about the COVID virus. So it is a virus, guys. So you guys know what a virus is, right? So a virus is like a little tiny thing that you can't see, but sometimes it can make you really, really sick. So the vast majority of people who do get any viruses, sometimes they feel pretty bad. They can have like a runny nose or a fever and a cough and things. But the vast majority of people who get any viruses feel better real soon. So, and that's not any different from the COVID-19. Again, the vast majority of people who get it tend to do well, but there are a few people who get really, really sick from it. So, but it's important for us to make sure that we know that we're educated about COVID-19 and how to prevent it. So I know you guys have been stuck at home lately doing homework from your parents and all these things and playing these games inside and not going to see all your friends and things. So that's pretty boring, isn't it, guys? But it's very important for you guys, okay? So I know you're getting tired of your brothers and your sisters and your parents and things, but it's really important for everybody because it gives us more times as doctors and scientists and things to get a handle on these things. So I'm pretty sure you guys have heard the word social distancing. Does that sound like a familiar term you've been hearing lately?
Yes.
All right. So that's really, really important because that helps to stop the spread of the virus. Again, viruses are really, really small things that you can't see them. You're not even with your naked eye, and even with powerful microscopes, you can't see them. It takes really, really, really powerful microscopes to see them. So, but they're so small, but it's really interesting that they make you feel pretty bad. So they can get spread from one person to another person, usually by like when someone's coughing or sneezing or anything like that, and that virus can get spread out. So that's why it's really important for you to stay away from other people to help prevent the spread of this virus. And that's going to be one of the major ways we get ahead of this thing, is that for the time being, we stay away from each other. So what the CDC is recommending, what people are recommending, is you staying at home, and if you have to go out, you have to stay 6 feet away from other people. So who here knows how tall 6 feet is? That's roughly probably the size of your parents, so you got to stay that far away from other people if you do have to go out. Okay. But again, you should only be going outside or going into stores or other things if it's for something that you need, and that's essential. So, okay. So again, most of these people who get COVID, they do okay. They don't feel good for a couple of days and they feel sick. They do get better pretty quick. They do get better over time, and especially kids. Thankfully, we're not seeing much, problems with kids who do get the virus at all. So, and we're still trying to figure out why that is and what have you at this point. So who here has been doing a lot of cleaning around the house? Have you guys been doing cleaning?
Yes. And
I
we
see
have our
some of you guys.
first question from the
Sure.
audience. Valen asked, do you, and I think you, Dr. Zach, do you have to stay away from your family when you get home from working?
I try to best I can. Not as much though, but I do. As soon as I get home, I immediately go to the shower and I clean things off and I decontaminate. So, but yes, as soon as I get home, I don't talk to anybody. I go straight to the shower. So I go straight to cleaning up. So, because the challenging thing is, who knows what I'm experiencing and getting exposed to while at work. So that's a good question. But it's also important too that while I'm at work, I got to wear these masks. I have to wear these gowns and things that help keep me protected from the virus as well. Because if I get the virus, then I can't take care of other people, right, guys? So if I get sick, then that's
Mhm.
one less doctor to help take care of other people who are sick.
Right.
So that really puts a strain on us at all times. So it's really important that me as a doctor on the front line make sure I protect myself. So you'll see me with big masks and goggles and like hair nets and gowns all the time. That's better to protect myself. So
And then does that all stays at the hospital?
correct. Yeah, a lot of them are disposable that I'll use them for each patient and throw away or sanitize afterwards. So
Thank you.
and that brings up a good point too about wearing masks. So you'll see a lot of people wearing masks. Who here has seen people wearing masks outside while they're walking around at the store? So that's important. So, right now we're still trying to get a handle on this disease process. So, you'll see a lot of people who are wearing masks to help prevent breathing in or expelling any of the virus. So they're trying to keep themselves safe and other people safe as well. So, have you guys seen some cool masks out there? Those people who are sewing their own mask and they're using like different types of fabric material and they have cool masks on. So that's maybe something you can take note of and maybe even make yourself with your family as well. So yeah, but a lot of the masks and respirators, we're trying to reserve that for the healthcare providers, for the doctors, the nurses who are really in contact with these patients. Yeah. Do I have any other questions on here at all? So I definitely want to try to leave this, open ended. So if you guys have any questions at all, I see some people on here, Valen and
I
Akshay.
can read a question that was emailed in.
Sure, go ahead.
So someone emailed and said, we have self-isolated for over 2 weeks, and I feel confident that we are not being exposed to COVID-19, except when we receive packages or deliveries of necessary items. How much caution should we exercise when these packages arrive? Are there any specific cleaning processes that we should be using?
Sure. Yeah. So again, this is a challenging time with this virus because we actually don't know right now if the virus can stay alive, if you will, on boxes or anything. So, but the CDC is recommending that you clean and you disinfect common surfaces. So, like desktops, doorknobs, countertops, tabletops, that you clean them frequently. Well, I do get asked whether or not you need to clean the boxes that come in from Amazon.
Hmm.
There's been no evidence to support that the virus can survive in these packages for long periods of time or what have you. But I'm a parent as well. If someone was to take a wipe to it, I wouldn't think that would be excessive. So.
And what is the best way to clean it? Like, is it Lysol wipes, bleach, vinegar, alcohol? Like, I know we were supposed to get like the 70% or higher alcohol for hand sanitizer and
Sure. Yes. And so any of those wipes or those cleaning products are good because they have so much alcohol or so much soap content to it that it can do a good job of killing the virus. The challenging thing is the vinegar. The CDC doesn't really recognize vinegar itself as being an agent because the thing is
okay,
it's so variable. So like the
okay,
vinegar that you make may not be as potent as the vinegar that I would make or that another
okay.
person would make. So it's tough for them to say, hey, vinegar is a good uh, cleaning product because everybody varies in how they prepare it and things. So,
Okay.
but any of the standard cleaning products that you guys see your parents using, like the wipes and like the Clorox sprays and those things are all good. So then they should be perfectly fine. So a good thing you guys can do at home with your family if you want to help clean is have an activity where you go around and clean all the doorknobs, or maybe even all like the handles for the refrigerator, or the handles to the washing machine, or the handles to the sliding doors and things. So I want you to walk around the house and think about all the things that you touch in a day. You touch the remote, you touch the doorknob to your room, you touch the toilet seat, you touch the handle. So, and think about all those things you touch every day in your house. And those might be good targets for you to clean with your family. You can take a wipe and just wipe them down, or take a spray and spray them and wipe them down. And that'd be very helpful, because again, you want to try to help stop the spread of this virus.
That's a great idea. And Valen said
Yeah.
he's been doing that with his sister.
Good. Now, you guys are on your way to being healthy.
Yeah. Okay. I have some other questions I could ask
Sure, go ahead.
if the audience doesn't have any currently right now. Does standard laundry practices kill a virus off of clothes or fabrics? Like, do we need to do
Correct.
anything different with our laundry?
Yes, nothing different. I mean, using just your standard soap products and detergent products,
Okay.
has been, it's fine. It hasn't been shown. The CDC doesn't have any recommendations against or for any particular type of cleaning products for laundry. So
Okay.
yeah, any standard one's fine.
And you did discuss the boxes. And so is it the same with the mail? Like, what if we wanted to mail a card to an elderly person? But we have symptoms, or we could have been exposed and we don't know it yet. Can we pass it on to someone else through a card or something that maybe we coughed on?
Probably unlikely. So
Okay.
again, these are all kind of we're still on the data gathering stage of this disease process. So it's probably unlikely that it's spread via mail, and especially something that goes in the mail and goes out for like 2 or 3 days. And the virus doesn't last very long out in the open. So
Okay.
the likelihood of it being spread via a box or via mail to your grandparents is highly unlikely. So with that said, kids, I expect you guys to be writing notes and letters to your family, okay? So you guys need to be writing some letters to your family members, because guess what? They miss you. They haven't been able to see you for a very long time. So it might be a good idea you talk to them about all the stuff that you've been experiencing and all the things you've been seeing lately with this virus. So they want to hear from you.
Definitely.
So write them a letter.
And Valen asked another question. He said, have you, Dr. Zach, treated anyone with the virus?
Yes, I have several people. So at the hospital. But again, I feel pretty confident treating these people because I'm wearing all the masks, I'm wearing all the gowns and things, and I'm taking a lot of precautions to save myself. Because again, I don't want to get hurt too, and I definitely don't want to bring anything home to my family. So I'm taking every precaution I can to help take care of myself as well. So.
Dr. Zach, I have a question for you.
Yes.
There are people, particularly in New York, but maybe here, who it will happen here during the surge, who are going to the hospital before they really need hospital level care because they're afraid. And that actually puts them at risk for getting the disease or the virus, excuse me, as well as putting them as well as putting other people at risk because the people who need the care aren't getting the care.
Correct.
So what do you recommend as best practices for people who are afraid that they might have the virus already, but aren't sick to the point where they need hospital level care? So what are those recommendations?
Sure. So really the recommendations at this point is let your symptoms be your guide. If there's concerns that you have COVID, you've been exposed to COVID-19, unfortunately right now, without there being a specific treatment for it, it's just more supportive care. Really what we need to be doing is just staying at home, but as long as you're not having any fevers or difficulty breathing or having any respiratory issues at all, you feel like you can't breathe, then pretty much quarantining yourself at home from your family is very important, is probably the best treatment. So really, to answer your question, the people who should be going to the hospitals are, guys, your family members who are really old, and, grandma or grandpa who have underlying medical problems and things, who feel like they can't breathe, they're running high fevers, or feeling very weak and very tired, and they feel like they can't, they can't breathe very well. So on the same note, people who are coming into the emergency room who are young and healthy and have, sore throat type symptoms, kind of, mild symptoms, we are sending home and recommending that they stay home and quarantine themselves. So kids, do you guys understand that what quarantine means? Have you talked to your family about what quarantine means? So it's really important if you see somebody, any of your family members who are staying in like the room all the time and not coming out and playing with you or hanging out with you, that you give them their space, okay? So, because if they're sick, they're staying in their room and they're staying, away from you to help prevent you from getting sick. So it's really important that, guys, that if you have your family members who are staying away, that you try to give them their space, okay? I hope that answered your question.
Thank you so much.
These are all good ones, guys. So
what can the community do to support healthcare workers and any of the shortages that we hear? Like, is it good to sew masks or?
Well, really to help with the healthcare providers at this point really is stay home. So you guys have no idea how much this social distancing is really going to play a role into the prevention of this disease and preventing it from getting really bad. Okay. So staying at home is going to be the best thing, guys, okay? So I know it's boring. I know you're tired of seeing the same toys over and over again, but you staying at home gives us time to help treat people who are really sick and really ill, who need some help, okay? So that's number one. That's the biggest thing you guys can do for the healthcare system and help me and help other doctors and nurses and pharmacists help take care of this, is really just staying home and hanging out with your family. So in reference to the masks, if you guys want to sew your own mask, that'd be a great idea. You guys can make your own designs and things, and it'd be really fun and a cool experience. I mean, however, to be perfectly frank, those masks aren't the ones that we really need much in the hospitals. We need the N95s. You hear that word put out a lot. We need the special respirators. I mean, those are the ones we need. So if you can make an N95, I'll order 100 from you right now. So, but those regular kind of surgical masks, I think they're a great idea. Personally, I think the CDC is on the brink of recommending people wear them when they go out now. I don't know if that's been official, but if I think that's more for like the general public per se. So, yeah.
Okay, let's see other one. Oh, we have another message here. Valen again, he wants to know, does it hurt to wear masks all day?
Sometimes it does. So Val, I wish I had the mask in here with me. I'm sorry, but it's a big respirator that goes around the front of my mask, my face like this. And it's all day long. It does hurt my face a little bit. And sometimes I come home with like bruises on the tip of my nose and things. So I look like Darth Vader.
Oh man.
Yeah.
Wow.
Let's see if I can get it in. So, yeah, but I have to wear all the time.
Yeah. And I wanted to know, is there a difference between coronavirus and COVID-19? In the news, a lot of times they're reported like it's synonymous, but is it really more like when the virus progresses, then you get something worse called COVID-19, like HIV progresses to AIDS? Is it something like that?
No, it's totally different. So coronavirus is a family of viruses, and COVID-19 is a specific strain that developed in Eastern Asia. So, semantics, but it's a different virus. A coronavirus is a well-known virus. It's the virus that causes the common cold. But this strand is a specific one that mutated in Eastern Asia. They suspect in the end of October, and then the floodgates opened and it just spread like wildfire.
So the specific strain, like that round ball that we see with the
exactly,
that's COVID-19 specific.
That's COVID. Yeah, it's a coronavirus. So guys, so corona is Latin for the word crown. So that's why it looks like a crown. So that's why it's a coronavirus. So that's why when they name these things, that's what they came up with. So.
Okay. Does anyone else have any other questions?
Yeah, these are good questions, guys. So.
What about just general tips for keeping our immune system strong?
Really, it's going to be staying healthy, eating all your vegetables, kids, right? So, well-balanced diet, getting plenty of sleep, and staying away from other people. That's going to be the best thing. So not a lot of sweets, guys, not a lot of, make sure you stay healthy and exercise. and just being a healthy kid in general is going to be the best thing you can do to help keep yourself healthy. So, you're not going to be able to fight any diseases if you're not healthy yourself, right? So it's really important you stay healthy, exercise a lot, get plenty of sleep, eat good, listen to your parents. That's number one. Right, guys?
Yes, definitely. I think those are all the main questions.
Yeah.
There was a question about, is there like an extra threat for pregnant women? Are they considered immunocompromised? Is there anything they should be doing to protect themselves?
I tried to look this up earlier today. Again, with this being such a new process, there's no real correlation to, being pregnant puts you at risk or not at risk. I believe some of the speculations are that the virus does not spread from mom to baby if mom does get it. But that's all, again, speculation.
Okay. And Valen asked, how do you know if someone has the virus or not?
Sure. So what we do is we can test them for it. Okay. So we take this long Q-tip, Valen, it's probably about this long, and we stick it in their nose, like all the way back, and try to get a sample. So it's not like we take a piece of tissue, basically we wipe the inside of your nose, and then we send that to the lab. And the lab takes, depends upon the lab, it takes a while to come back, and that's the way we find out if they have the virus or not. So that's a really good question.
So you can't tell this by looking.
Correct. There are, side note, there are kind of, signs and symptoms that suggest it, but to definitively diagnose it, we need to get a sample. So, Valen, you're asking some good questions today, bud.
Yeah, really great.
Mm-hmm.
Yes, I think those are all of the questions we have. If anyone else have any last questions they want to
Valen,
chat?
how old are you, bud? You look like you look a little 7-ish. Good
7.
job.
Great.
You gonna be a doctor when you grow up, Valen? Thumbs up, right? Okay. All right.
Okay.
So
what about, I do have one more question.
Good.
So when people are stuck at home, not everybody has the safest home situation. So is there ways that we can support the community while staying at home and social distancing? Is there anything that we can be doing? Like, I don't know, just any recommendations you've heard of that you could share with us?
Really, again, it's going to be the staying at home is going to be the best thing, and keeping people safe is paramount.
Well, what if you do hear of it's like a child's maybe like in an abusive situation or something? Like, does the hospital have any resources where you can make complaints or something for child welfare?
Sure. So those issues at the hospital we specifically don't have. So I would probably recommend more of the health department getting involved, because then they can get the child services involved and things. So, and that is one thing we're struggling with is these other social situations. Like, we see homeless people, we see, people who are, don't have any access to healthcare, and what do we do with those? So we are still trying to figure out what to do with these waves of people who don't have the greatest social situations. So
yeah.
Mm-hmm.
Yeah, these are big societal.
Correct. Yeah. Even outside of COVID-19, it's important
yes
stuff. Yeah.
Well, great. Thank you. Oh, one more. Let's see. One new message.
Sure.
What if I get hurt? This is also from Valen. Is there a safer place to go than the hospital right now? Oh, that's really a great question.
That is a good question. So really, I would defer to your parents, but there are urgent cares that are still open. Your pediatrician can still talk to you and see you. So there are still other avenues you can go to get care if you're not feeling very well. So say you hurt your wrist, or like you fall down and hurt your leg or something. There are all still other places you can go. So, and we will still see you at the hospital as well. So what we try to do, Valen, at the hospital is if you feel sick, like maybe you potentially have COVID, we try to isolate those people on one side of the hospital where they're not there. I mean, if push came to shove and you had to come to the emergency room, we would love to see you. But I would try to see if you can talk to your doctor first, or go to urgent care, go to these other places that, potentially less sick people are at. So, but we'll always see you, Valen, if you need it.
That's a really great question.
It is.
And I know a lot of offices are like doing extra precautions, like you can't bring other people with you if you do go to the
Correct.
doctor.
Yes. We've actually instituted at our hospital no visitor policy.
Okay.
So yeah, unfortunately. So if you go to the hospital, no visitors, unless it's, unless it's extreme, it's warranted, end of life thing, or labor or things like that. So yeah.
Wow.
Yeah. So it's definitely a challenging time in medicine right now, guys. I know things look a little scary at times and you don't understand what's going on, and like, why am I stuck at home? What's going on? I'm so tired of this and things. But just remember, your parents are just as tired as well. But this is an effort to make sure everybody else feels better. So and to get ahead of this, and to make sure we treat this virus so we can get it to go away. So hopefully it'll never come back. Because the last thing we want to do is give you guys the all clear to go out and play and go see your friends. And then all of a sudden it gets worse again. So you guys wouldn't want that, would you?
No.
So no. So let's go ahead and do it right. And let's do it right the first time. So it's really important you guys listen to your parents and make sure that you stay at home and stay healthy. Wash your hands. Do you guys know how long to wash your hands for?
20 seconds.
20 seconds. So what kind of songs can you sing while you're washing your hands?
You guys want to write some in chat?
Yeah.
ABC.
ABC song, the happy birthday song, or any song, as long as it's 20 seconds. That's all I care about. So that's important to wash your hands as well. None of this and I'm done thing. No, you got to make sure you get all the way on both sides of your hands, and also get between your fingers as well, and at least get up to your wrist as well, guys. Okay, so it's really important. And wash your hands often. Okay, so that's really important.
And we should be trying to avoid touching our face.
Yeah, as much as you can.
Okay.
Yeah, but if you have clean hands, you should be okay.
Okay.
But yeah, try to avoid touching your face as much as you can. Okay,
great. Any other questions? Oh, and fingernails, Valen
yes. Yeah, get between them. Get under those fingernails, guys. Okay.
said. Yeah, that's a really important tip. Okay. Thank you so much, Dr. Zach, for your time volunteering to do this for our families. Thank you, families, for taking the time to call in. We hope you all stay well and take Dr. Zach's awesome advice in keeping safe. And we look forward to keeping in touch.
Wonderful, guys. All right, kids, make sure you listen to your parents and give them a break from time to time, okay?
Yes.
Nice. Okay.
Bye, everybody.
Bye, guys. Take it easy. Thank you.